Hi, how are you?
Wait a moment, excuse me. Yes, it's right now.
Okay, hi, how are you?
How are you, Angela? How are you? What are you doing?
Doing good, doing good. Just having some lunch.
Yes?
While
Good, very good.
we talk, yes. So,
So,
good.
as I was telling to Angela before, I am a junior coach and she is one of our speaking partners. And she is gonna help us trying to study, and also she is helping us with our purpose in the foundation, that is give education to people who doesn't have that tool in this country. Okay, so you already
Yeah.
know about the foundation, Angela?
Yes, a little bit. A little
Okay,
bit, yes.
so as I told you, we help people, giving them the language, in this case is English, but also we gave them something else more than just English. We gave them how to know their human rights and create social conscience and
Good,
a lot of things that make the society a good one, I would say.
good.
So
That's great.
yes,
That's
and
wonderful.
we have been studying here um, more than 2 years as junior coach. But I
Okay.
arrived here 1 year ago. Okay,
Oh, okay.
so thank you so much for being here. Now, I look for that little or short article about the neutral
Okay.
networks in borderline personality disorder. So
Okay.
I don't know too much about that because I wanted to you correct me, and if I have some mistake in writing or if I don't know a word, you can tell me what it means and what is the best way to use that word. Okay?
Okay. That sounds good.
Thank you
Great.
so much. Okay? So we are gonna start right now.
Okay.
So the title is The Neutral Networks in the Borderline Personality Disorder. New research examines, oh, excuse me, what is the pronunciation of that word?
So examines,
Examines,
examine, hmm
okay,
examine,
examines
examine.
the neuroscience of borderline personality disorder. People with borderline personality disorder, BPD, have what many consider a chronic and perhaps untreatable condition involving lifetime patterns of difficult regulating. What is the pronunciation of that one? Excuse me.
Sorry, and so it's saying physical, I'm not sure, physical regularity or physical.
Oh, excuse me. I'm gonna share my screen.
Sounds good. That'd be great. Thank
Yes,
you.
I forgot it. Excuse
Yeah,
me.
it's all good. I was like, I'm not sure.
Now can you see my screen?
Let's see. Yes, great.
Okay, thank you. So is that word? Oh
Let
no,
me
is
see
that
if I
one.
can.
Is that one.
Okay. So, and perhaps untreatable. Was that the one? No, no. Regulating,
Mm, regulating.
Mhm.
Regulating
Uh-huh.
modes.
Regulating.
Moods. Regulating moods. Identity. Instability. Problems in the interpersonal relationship. Oh, what is the pronunciation of that
Mhm.
one? Excuse me.
So, interpersonal relationships,
In
relationships. So, it kind of does two relationships,
okay, interpersonal relationships.
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 Uh-huh.
Thank you so much. And the
Uh-huh.
episode or self-injury.
Okay.
If you know,
And so
tell me
I was just going to say the episodes
the
of,
episode of
um, oh, mhm,
the
that's
episodes
great.
of self-injury.
Mhm.
Thank you so much. If you know someone with this disorder, you are perhaps aware of seriousness. Could you help me with that one? Excuse me.
So that was good. Seriousness, seriousness,
Seriousness.
uh,
Seriousness
seriousness.
of the
Hmm.
symptoms,
Hmm.
but also of the potential benefits of psychotherapy. Psychotherapy.
And so that's just psycho. Yep, psycho. Ah, psychotherapy. Yeah.
Thank you. Psychotherapy. Okay, good. However, you may also be aware that although therapy methods are being designed that have demonstrated efficacy. Is efficacy?
That's right.
Okay, very good.
Efficacy.
Efficacy. There still is not a one size fits all. How should I
Yep. So fits all. One. Mhm. So one size fits
one
all.
size one size
Size
fits all?
fits. Yeah, fits
Fits one size fits all.
all. Hmm.
Approach that work for each individual with the disorder.
Hmm.
Okay,
Good.
Angela, until there, what do you think
Hmm.
is the topic about?
So they're talking about this personality disorder, that a mental disorder that people have sometimes.
Yes,
Yeah.
yes, very
Yeah.
good. Thank you.
Yeah.
Let's continue. According to the
And
new,
does it make sense to you what they're talking about? You understand?
tell me, excuse me.
Do you understand what they're talking about there?
Yes,
Does that make
a little
sense?
bit. A little bit, because you know that when we are learning English and we are trying to read, our brain is just
Yeah,
focusing the pronunciation and how do we
that's
have
true.
to read or something like that, and we
That's
lost completely. That's why we have to be focused in
yeah.
in those two skills.
Yes, so true. So true. Interesting.
Okay, thank you.
Okay.
According to a new study by Melinda Westwood, what is the pronunciation of that last name? Excuse me.
So Westland,
West
Westland,
Westland. Good. Westland.
Westland. Uh-huh.
Uh-huh.
Westland.
Schreiner. Excuse me. Schreiner.
So they'd probably do Shriner. So you hear
Schreiner.
that I sound, Shriner.
Okay. Schreiner and college.
And that's
2019.
in colleagues. So it's colleagues. You just kind of say that G kind of hard. Colleagues.
Okay, it's
Colleagues.
colleagues.
Uh-huh.
Good, colleagues.
So a
Thank you.
little different than like, a little different than like college. It's colleagues. Yeah, colleagues.
Colleagues.
Hmm.
Yes, because it's almost the same word, I would say.
Yeah. So similar, but yeah, such a
Yes.
different sound, darn it.
Okay, thank you so
Yeah,
much.
colleagues.
College,
Yeah,
college.
colleagues. Uh-huh. Colleagues. Hmm.
2019 of the
Hmm.
University of Minnesota.
Hmm.
These generic approaches to BP.
And so just want to say that G hard again. Generic.
Oh, yes.
Generic.
These generic
Hmm.
approaches to BPD can only go so far in review the research on the treatment with medication. Schreiner, Schreiner, et al. Note that such treatment as mood stabilizers may help
So
some
that would be stabilizers.
stabilizers.
Stabilizer.
Okay,
Uh-huh.
thank you. Treatment as mood stabilizers may help some but not all BPD patients reduce
Mhm.
episodes of anger and lack of impulse control. Antipsychotics work for other systems such as anger and this.
So just really quick, that it's so like you just kind of say like antipsychotics
Okay,
work for other,
antipsychotics
mhm, and then work for other symptoms.
symptoms. Okay,
Symptoms.
thank you.
Uh-huh.
Symptoms. Symptoms. So work for other symptoms such as anger
Mhm.
and the so so called. What is that?
Uh-huh. Yep, so called. So just saying that's another name that it might be called. So called. Yeah,
Okay.
it's kind of a strange
Yes, it's a little
little
bit
thing.
strange. Yes. So
Uh-huh.
called
Yeah, so called. Uh-huh.
cognitive cognitive perceptual symptoms, excuse me, of dissociation. Is dissociation? Is it? Okay. And reality testing.
Yeah.
Antidepressants.
So again, that antidepressants, anti, so think
Okay, good. Thank you.
antidepressants.
Depressants. Antidepressants. Perhaps we have the least therapeutic effects across all, but they may still be useful for some individuals. Since no one approach works for everyone or all symptoms, Schreiner and College
Mm-hmm. Yes,
believe
yes.
that treatment must be tailored. Tailored. So,
Mm-hmm.
excuse me, could you tell
Good.
me what is the meaning of tailored?
Tailored. So like they're going to make it so it fits for that person. So like if you were going to tailor the meal around someone's diet, you'd
Oh,
kind of make it so it would fit their symptoms, is what they're talking about, make it to fit their symptoms. So meaning that they might not give them the same medication that they might give someone else. They
okay.
might give them, something else all natural or something like that. Yeah, just make it to fit for them, tailor it to them. Yeah.
Okay, thank you so much. I didn't know it, excuse me.
Yeah, it's tricky because really tailor can be like getting your clothes tailored. If you needed to get your clothes hemmed up or shortened. So
Oh,
that's a little tricky because it can mean to, but it's kind of like to make it fit. So you tailor your clothes or you tailor, in this case, symptoms, the medication they're going to take or something like that.
okay.
Make it fit.
Thank you so much. The symptoms shown by the individual patient with BPD, such individualized. What is the pronunciation?
So that one you'll just say, so you do the individualized and you just say the
Oh,
D. So individualized, just the
individualized.
D. Uh-huh.
Individualized.
Uh-huh.
Thank you so much.
Yes.
Strategies are consistent with priorities of the National Institutes of Mental Health (NIMH) regarding
Mm-hmm.
greater precision in the treatment of mental illnesses. P. 58. The University of.
And I was just going to mention when you see those things in parentheses like that, you don't necessarily need to say them. You could say the NIMH, or you could say the page 58. That P just stands for like page 58. But usually, like if you were like telling somebody this story, you might kind of skip over those. Just
Oh,
just a side note. Just wanted to mention, just so you know.
okay, thank
But,
you. That is a good tip because I didn't know it. Thank you so much. The University of Minnesota team believed that by understanding the neurobiology of BPD, therapies involving medication can better target and treat the individual's symptoms.
yeah,
Any correction until there?
good. That's good. That's great.
Okay. Now, until there, do you have an opinion or do you have an idea that you want to share with me about this paragraph?
Um, yeah, it's just interesting to think about it. People having this disorder, because obviously there's lots of different mental disorders, and I'm sure you maybe have heard of some things. I'm not sure how to say it in Spanish, but like bipolar or depression and
Yes.
different things like this. So it's interesting to hear in this magazine, this Psychology Today, about what they're looking at to help these people that have BPD, which I've never heard of before. But I think it's interesting to see how, again, that they say it's so true, how not every person reacts, to say a medicine. They might need something all natural, or some other way. This is interesting. It's really interesting.
Thank
Do
you.
you know where Minnesota is in the United States? Do you know where
Uh,
that is?
with what? Excuse me.
Do you know where Minnesota is in the United States? This
Community.
university?
Oh yes, I have heard about Minnesota, and I guess that is a
Yeah,
cold place, a really cold place, I would say.
yeah,
It's bitterly
that's right.
cold
Yeah,
by there.
yeah, yeah. In the winter, it gets pretty cold. It's up north, the very north of the United States, so
Oh,
almost to Canada.
oh
Yeah,
yes,
up there. So
good.
yeah,
And the
yeah,
university is also there. Yes.
yeah. Yep.
Okay.
So that may be interesting.
Yes, good. Thank you. Thank you so much.
Hmm.
Continue. The
Sure.
Schreiner, the Schreiner ET-O approach comes then from a biology
And so sorry, just the Schreiner et al.
Schreiner et
That's,
al.
yeah, it's just kind of, yeah. Anyway,
Okay, thank
Schreiner
you.
et al. Which,
Thank you.
yeah.
Schreiner et al. Approach comes then from a biological perspective rather than
Uh-huh.
one involving an understanding of the physical contributions.
Sorry, so just the
Oh yes,
psychological.
psych. I
So I
have
always think like psycho,
psycho,
like
psycho.
psychological,
Yes, thank you.
psychological.
Psychological contributions to BPD. The authors
Mhm.
note that BPD can be
The
treated.
authors. So the
Authors,
authors.
others,
So kind of that authors.
others,
Authors.
others. Thank you. Note that BPD can be treated successfully with psychotherapy, but many patients also require some form of psychopharmacological intervention.
Mhm. Yeah, so let's just back up to the but many patients.
Okay.
So that's like not saying like patients at a hospital, like if somebody got hurt, patients. But there's also, it sounds a lot like another word, like, have patience, don't be in such a hurry. But that's patience. This one is like patients at a hospital, patients. And then down to the psychopharmacological. That's a huge word. Oh my goodness.
Yes.
Psychopharmacological. And then
Psychopharmacological
intervention.
inner
Intervention.
intervention.
So if I was saying it really right, intervention. Sometimes we don't say our T's very good, but intervention.
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 Okay, good.
Hmm. Yeah.
intervention, psycho psychopharmacological intervention.
Yeah.
At,
Yes. See. Good.
okay,
Yeah.
thank you so much. At present, though,
Mm.
the U.S. Food and Drug Administration has not approved any one BPD medication. Having medications as a treatment opinion, Schreiner
Mm.
and her colleagues.
And sorry. So it's just option. That's just treatment option.
Okay,
Option. Just kind of makes that shun sound with the T as a treatment option.
okay, as a treatment
Option.
option, as a treatment option, Schreiner and her
So colleagues.
colleagues,
Mhm.
yes, colleagues believe,
Colleagues.
colleagues, yes,
Uh-huh.
colleagues believe can be value for those who may have limit access to qualified therapists and may provide added added. Okay, excuse me. What is the meaning of
Mhm.
added?
Yeah. So let me actually. So added. So like more. So we have lots of different words for things sometimes, but you could say it provides more benefit or added benefit or an increased benefit. So it's just saying more. There's more of a benefit if they have, this. So if people are engaged in some type of therapy, is what they're saying, like some kind of counseling, then they'll have more of a benefit than just taking medication. So more benefit. And I was just going to mention too, back on that colleagues. Did you know what colleagues meant? I'm just going to
Yes, is
ask if you
like
know.
your coworkers or people who is around you, I would
Oh,
say.
good, 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 good. And I was just going to mention on the, and then it says, and our colleagues believe can be valuable,
Valuable.
just to
Oh,
pronounce that,
valuable.
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 hmm And then just a little bit down where it says, for those who may have limited access to
Qualified.
qualified, qualified therapists.
Qualified
Yeah.
therapists. Okay, thank you.
Uh-huh.
And may provide added benefit to those engaged. Engaged. Excuse me, what is the
So, so
pronunciation?
that's going to say engaged, engaged,
Engaged. Yes, thank you so much.
uh-huh.
Engaged.
Engaged,
And what
uh-huh.
is the meaning of engaged?
Engaged to those like participating. So again, it's another word. This is where English can be kind of tricky because we can use so many different words to mean the same thing. But yeah, to those who are like participating in therapy session or counseling session. So participate, engage. They're participating.
Okay, thank you so much. I didn't knew it.
Okay.
I didn't know it, excuse me. In an empirically supported psychotherapy. 62.
Mm-hmm.
Page 62, excuse me. Um, Even if you are not a strong proponent, is that the pronunciation?
Yep. Proponent. Uh-huh.
Proponent of the
Proponent.
biological, bio, bio, excuse me, I cannot,
Logical.
cannot,
Yeah. Yeah. So I kind of just think like the bio first, biological. So biological, biological.
biological, okay, thank you,
Uh-huh.
biological approach,
Uh-huh.
biological approach. It is,
Biological.
it is a stringing,
So
intriguing,
intriguing. So that
intrigue,
means like it's
intriguing,
interesting or something. Intriguing.
intriguing.
Again, they're using a lot of really big words that we
Yes.
don't necessarily use when we're talking. But yeah, it is intriguing or interesting. Yep.
Okay, it's interesting. Interest.
Yeah, but intriguing is the word that they used. Intriguing, but it means like it's interesting or something to think about.
Okay, thank you. Uh,
Intriguing.
intriguing. Excuse me, intriguing.
Mhm.
To think that BPD symptoms can be traced.
So that one would just be the traced. So just the D. It's tricky because some words are the ED sound, but this one's just traced.
Traced. Okay, and what is the meaning of traced?
Mm. So like that they can find that a lot of the symptoms, I can kind of trace, follow it back to find sources of where it affected people, how they got BPD. They can kind of follow it back, trace it, like you trace with a pencil, or something like you
Okay, thank
follow
you.
it.
Thank you so much. To reliable sources of variation,
So reliable. So just the long I, reliable.
reliable
Mhm.
to reliable sources of variation in neutral networks that
And so,
uniquely.
and so that one's neural, like
Oh, okay.
talking about your brain, neural, instead of
Neural.
like neutral, which, yeah, neural,
Okay,
your,
thank you.
your,
Neural. In
like
neural.
neurology, the study of the brain, neurology, neural.
Okay, thank you. In neural networks that uniquely characterize individuals.
So that's a hard one. Characterize,
Car
characterize. So think of
characterize.
character,
Okay, thank you.
character, and then eyes. Eyes.
Characterize individuals with this disorder.
Yes. Uh-huh.
Is a Schreiner and her colleagues review the literature of on functional magnetic resonance imaging.
Yeah. So magnetic,
Magnetic
magnetic resonance,
magnetic resonance
resonance.
magnetic
Uh-huh.
magnetic resonance imaging. If
Uh-huh. And
MR.
again, you don't necessarily need to. Yeah.
Okay. Note that people with BPD have been found to have increased in activation compared to controls of the amygdala. Is amygdala
That's just a
or
part of the brain.
amygdala?
Yeah. Amygdala. You're right. Which is just a part of the brain. Uh-huh. Amygdala.
Okay, good. Amygdala, the brain region involved in fear. When they are exposed to negative emotional stimuli,
So stimuli. Stimuli. So that's like the plural of stimulus. Like if you got, a stimulus, you got a little shock or something.
okay,
Emotional stimuli. Yeah.
thank you. Emotional stimuli. Other neuroimaging methods combined with fMRI shown further that the people with BPD may have hypersensitive response to information or negative nature. However, the
And
findings.
just nature. Just nature.
Okay,
Uh-huh.
nature.
Long edge. Nature.
Nature of negative nature. However, the findings based on the neuroimaging techniques also show variation among people with BPD based on their behavioral symptoms by matching
Mhm.
functional connectivity patterns with specific symptoms. It may be possible Schreiner et al. Believe to understand how how the neutral circuits
So
underpinning,
yeah, neural circuits.
neural circuits, underpinning,
Circuits.
a specific dimension,
Underpinning.
underpinning,
Mhm,
underpinning a
mhm,
specific dimension of BPD might change with treatment. Page 59.
uh-huh.
To explore these questions. Oh, until there, what do you think about it?
Yeah, so it was just, I think it was good that they brought up that, a lot of times medication isn't the only solution. It was talking about the possible need to have counseling and things like that. Um, when people have these different things, which I've seen in my own family. So I really appreciated that they talked about that it is helpful to talk with someone and try to work through what you can do, or, to try to, work on those behaviors and things like that too. And it's interesting to talk about how they talk about that different part of the brain being activated that involves fear and, anyway, negative emotional stimulus, which I just think is interesting to think about how that works. There's so much that goes on in our bodies, that we don't even really think about.
That's
It's
true.
just interesting. Yeah,
Because
it's good.
our body is a machine that we never are gonna know enough, I would say.
Yes, so true. So true. They're amazing.
Okay, so let's continue. To explore this question, the University of Minnesota researchers recruited, recruited, recruited,
Yeah. Yeah. So on that one, you're going to say the ed. Yeah, recruited, recruited,
recruited. Oh, so we don't say the I. Recruited, recruited,
recruited. Uh-huh.
recruited,
Yes, you kind of say the ed. Recruited. Uh-huh.
recruited. Okay, thank you. Adults ranging from 18 to 45 years old with the
And on that, you just want to say ranging. So just kind of again hit that G, the J, ranging,
okay,
ranging.
ranging, ranging from
Mhm.
18 to 45 years old with the diagnostic or BPD and no other current diagnostics.
Yeah,
Participants
and on the diagnosis, just hit. It's just a hard I again. So a long I diagnosis
diagnosis
at the beginning. Uh-huh.
diagnosis of BPD and no other current diagnosis. Participants were not on a physic, physi,
So again,
psychotherapy.
that psycho,
Psycho, yes,
psycho. See, don't
psycho,
say that. Mhm, mhm.
psycho,
Psycho
not on
therapeutic.
psychotherapeutic
Mhm.
medications and the start of the study and could not begin psychotherapy for a study's duration. The final sample consisted of 19 individuals with baseline fMRI data.
And so just back to that word baseline. So base and then line. You think about those two separate words, baseline.
Okay, baseline.
Mhm.
Thank you. Baseline.
Yeah, that's great.
The simple consider of 19 individuals with baseline fMRI data, of whom 13 provide usable fMRI data at the end of
And then just really quick on the usable. So think of the
usable.
word use and then just usable.
Okay,
Usable.
thank you. Usable fMRI data at the end of an 8-week experimental intervention study. Within this sample, the treatment group received an anti
So received. It'd just be a long E, received.
received received
Mhm.
anti no is anti antipsychotic Psychotic,
Antipsychotic. Uh-huh.
antipsychotic, antipsychotic medication. The brand name Seroquel, Seroquel, and the control received a placebo. Their
Placebo. Uh-huh.
placebo,
Placebo.
okay, placebo. Their psychological symptoms were assessed with a standard BPD measure that produces scores on scales of affective emotional disturbance.
Okay. And just back to that word scales, like
Scales.
scale you weighed yourself. Scales. Uh-huh. Yeah. Scales. Uh-huh.
Okay, thank you. Scores on scales of affective emotional disturbance, cognitive disturbance, distor- distorted perception, perceptions,
Mm-hmm.
impulsivity,
Mm-hmm.
impulsivity, and disturbance in relationships, both participants and clinicians, clinicians,
Yeah. Clinicians. Uh-huh.
clinicians,
So like a clinic, but the people that work there, clinicians. Uh-huh.
clinicians, thank you, clinicians provide rating on the presence of each
And
symptom,
so that's just ratings. So provided ratings.
provided
So like a
ratings,
yeah, like a scale
providing
score.
ratings,
Provided ratings. Ratings. Hmm.
okay, providing ratings on the presence of each symptom, but only of data from participants were used in the current study. Until there,
In the current study.
okay, until there, what do you think about it?
Yeah, that's good. Yeah, it's interesting to hear the study. I'm always fascinated by studies that they do to see um, and to see, what was causing it or what they're seeing, like their symptoms are with how they're having some emotional disturbances and feeling very impulsive and have trouble with relationships and just think, yeah, it's interesting to think about that and sad too to think that
Yes,
people have to go through these really hard things. I think we all do on some degree, but obviously this is pretty extreme,
and
hard times. So
and
interesting.
and also try to understand the human brain or try to give them a solution is really hard
Yeah.
for the researchers or all the people that is working every time to try to know how the brain works. And it's good
Yeah.
because we know that as a normal person we don't pay attention to those things, but they are really important.
Yeah. And I think it's good that I think a lot of doctors are starting to realize that like nutrition and exercise and these types of things can help a lot of people too. That it's not just medication all the
Yes,
time or,
all the time.
obviously there's extreme situations where, exercise and diet aren't going to help a ton, but it's still nice that they're looking at those things too to help people keep their brains strong and healthy and things like that. It's good.
Yes, good. And do you think that social life is important using as a tool to like fight against those problems or symptoms?
Sorry. So do I think what is? Sorry, social life?
Yes,
Like,
social life is important to try to um, like
yeah,
improve
yeah, for
those.
sure. I can see what you're saying now. Yeah. And I think, we have to just be careful now today with all of the technology, the cell phones and the social media and things like that, we do still talk with people and have conversations and get together and, that we don't get too tied up in video games or, those kinds of things too can really affect us. And, they talk about how much it can affect children. And anyway, so yeah, it's certainly important to get out and about, get out in nature and all those things.
Yes,
Important.
that's right.
It's good.
So, we are about finished. So I'm gonna
Okay.
read the last ones. In the first test
Okay.
session, the research team administered fMRI for 6 minutes, during which they asked participants to relax with their eyes closed but to remain awake. The
I
neuro
was going to just say to relax
to
with
relax
their eyes,
with their eyes,
relax, and then remain awake.
okay, remain
Remain
awake.
awake. Uh-huh.
To relax with their eyes closed but to remain awake.
Hmm.
The neurogaining data also include maps.
So the
Oh
neuroimaging,
yes,
neuroimaging.
neuroimaging data
Uh-huh.
also include maps of whole brain connectivity. These data were used in a statistical statistical what is the pronunciation?
Statistical. So like
Statist,
statistics,
statistic,
statistical.
statistical statistical
Uh-huh.
model to predict the scores participants received on the BPD subscale. Additionally,
Subscales.
subscales, okay, thank you, subscales, additionally, using the post-test scanning data, the researchers were able to calculate the changes in brain activity in relation to the psychology test score, comparing the treatment and the placebo groups. Thus, although the sample was small, this
The
analysis,
sample.
the,
I just wasn't sure. A sample was small. Did you
oh,
say sample?
okay, although sample was small,
Hmm.
this analysis allowed the research team to explore both changes in brain scans before and after treatment, as well as the relationship between these changes to types of BPD symptoms.
Good. So back at the these analyses, these analysis,
This
these
analysis,
analysis was a little bit farther up.
okay,
The third line up. These analysis allowed
this analysis
analysis
allowed
analysis,
this analysis allowed
and then
the
the
research
very last word was just symptoms. Symptoms.
symptoms, symptoms, symptoms.
Symptoms. Uh huh.
That's why
Awesome.
English also is tricky because you know that always the y the when it y is here, we think that is I, or we think that is C.
Yes.
We're not sure never about it.
Yes. Yes.
That is just for
Yeah.
reminding us.
I'm trying to learn Spanish. I'm trying to learn Spanish, and so obviously I have the opposite problem when I'm
Yes.
trying to learn Spanish. So I completely understand. Completely understand.
Okay. Even if you need some help, I don't know, in whatever thing you need about Spanish, all the junior coaches and all the
Mhm.
foundation are gonna help you. So you just have to write, and we are gonna answer you as soon as possible. Okay?
That's great. That'd be nice.
Thank you so much.
That's
Okay.
great. My daughter's in Argentina and she's learned Spanish, so I've always wanted to learn too. That's fun.
Yes. Good.
Yeah.
So she has
Yeah.
lived there almost all her life, or
She's been there for 9 months. She's a missionary with our church, Church of Jesus
yes.
Christ of Latter day Saints.
Oh
They
yes.
walk around with white shirts and little black tags. Well, the girls don't have white shirts, the boys do, but she's a
Okay.
missionary out there talking about God. So it's fun.
Good. That's really
But neat that she
awesome.
gets to learn Spanish. Yeah,
Good.
it's really fun.
I have knew a lot of people who are missionaries and they have been here helping us also, and some of
Oh,
the
good.
speaking partners that we have also are from the Church
Oh,
of Jesus Christ, and that is awesome. I really would like to
oh,
know more about that religion. Well, it's not like religion. I guess it's more. is more than it.
Yeah. Yeah, it's great. I love the whole surface aspect that people just want to serve and help, and that's what God would want. So it's great that you're doing this program. This is awesome. Really
Thank
neat.
you so much. Uh, let's finish with that one. Um,
Uh-huh.
as the authors predict in
The
the
authors, so
authors,
like the people that wrote this, authors.
authors, as the authors predict, individual with different BPD symptoms showed different patterns of activation in the brain, suggesting suggesting they differed in their susceptibility susceptibility
That's kind of tricky too. So susceptibility,
susceptibility
susceptibility.
sep-
Again, just a really big word we don't use very much, but like being susceptible to something, like you might get sick easy, or you're susceptible, in this case, to negative stimuli. Mhm.
okay, susceptibility
Susceptibility.
susceptibility to negative stimuli.
Stimuli. They just say that I at the end.
Yes,
Stimuli.
stimuli. Those with
Mhm.
higher impulsivity scores, self-injury, excessive drinking, and high spending had increased functional connectivity at the rest RSVC between the right amygdala and
Mhm.
left hippocampus. Hippocampus.
Hippocampus. Uh-huh. Hippocampus.
Hippocampus.
Yeah, that's right. Hippocampus. Mhm.
Another limbic system organ that is involved in processing short-term memory and may be involved in peer learning. Those
Mm.
high
Mhm.
in cognitive disturbance, identity disturbance, paranoia, and dissociation reduce their fear sensibility, sensibility,
So sensitivity,
sensitivity
sensitivity.
as measured by the fMRI over the course of the study, but in the left amygdala, left left temporal lobe. What is the meaning of lobe? Excuse me.
Lobe. So that's just the side of the brain. So left temporal lobe would probably be right around the ear. Left temporal lobe, I think.
Okay, thank you.
I
And
think so.
left the hippocampus. Thus, the authors include that dissociation may be related to different brain activation than impulsivity. Finally, people hide in disturbed relationships shown yet a third area of activation involving the right amygdala and right frontal lobe. As the author conclude, it is impossible that
Authors.
others, I, I have to remove,
That's hard. The auth. Those th. Authors.
as the authors conclude, it is possible than, that the difficulties in interpersonal relationships may be a significant source of distress among those with BPD and lead to exacerbation of their symptoms. Page 63. A conclusion consists with psychological theories of BPD because
Okay. So and again, psychological theories.
psychological theories of BPD because of the small sample size and therefore the small numbers in control versus treatment groups, the University of Minnesota study could not pinpoint. Okay, what is pinpoint? Excuse me.
Could not like find the exact role of the specific type. So they're trying to just kind of, if you think about a little pin on a map, they're just trying to find the exact spot. Could not pinpoint.
Okay, could not pinpoint the role of this specific type of medication in reducing BPD symptoms via changes in the brain or the psychological symptoms scales. However, the apparent connection of BPD symptoms
That's
apparent
apparent connection.
apparent what is the meaning of
Mhm.
apparent?
I mean, they think that means like they think. So apparently there's a connection. They think.
Oh,
So, possibly connect apparent. There's an apparent, it looks like there's a connection. Looks like
thank you.
there's a connection.
Thank you so much. Connecting of BPD symptoms to differing patterns of brain activation suggests that the personalized treatment approach is worth pursuing. What is the pronunciation?
Like going after. So if you pursue someone, like you were chasing them down the street because your child forgot their lunch, you're pursuing them. You're going after them.
Okay. Pursuing further at some point in the future, were this approaching to be further validated, validated, it could
So further validated, further validated.
further validated, further
Uh-huh.
validated,
Further get validated. Uh-huh.
further validated. It could potentially provide people with BPD yet another avenue for treatment, allowing their particular brain activation patterns to be matched with target therapies,
Okay, so
medication.
with matched, so just matched.
Okay,
So again, not
matched.
it just doesn't say the ed, it just says the d on that one, matched.
Uh-huh.
And then with targeted, so
Targeted.
that one says the ed, targeted. So it's kind of tricky. Matched, targeted. Mhm.
Matched with targeted. Matched
Uh-huh.
with targeted therapies.
Uh-huh. Mhm.
Medication would be part of this picture by psychotherapy could also become part of a broader biopsychological intervention.
So again, I just go bio,
Bio
psycho, social, bio, psycho, social.
biopsychosocial intervention.
Uh-huh.
Thank you.
It's great. Just divide that word up. Bio, psycho, social. Good.
Okay. To sum up, BPD is a complex disorder with multiple contributing factors and varying types,
So varying,
varying,
yeah, varying. So you kind of say vary and then just add on the ing, varying.
varying, varying
Mhm.
types of primary psychological dimensions. The trainer it all, excuse me, a study indicates that there is as yet untaped,
Like
untapped,
tapped. They
tapped.
haven't seen all the potential yet, untapped. Uh-huh.
What is the meaning of untapped?
Well, that means like you haven't seen, so there's more. It means there's untapped potential. Like you have more potential than, just working, job that is only an hour a day or something. Like you could do 5 hours a day, untapped potential, you could do more. Mhm.
Okay, thank you so much. Untapped potential,
Un- untapped,
untapped potential,
untapped. Mhm.
untapped potential for neuroscience to advance our understanding and treatment of BPD. And that's
Uh-huh.
all.
Yeah. Good. And I was just going to mention on the Shriner, when it says the Shriner et al., that little et al. At the end of when they do
Schreiner.
that after his name, they're just trying to say like all the different authors. I don't know if you see down at the bottom how it says like Shriner, Klimes, Mueller, Nelson down on under references, all these different names.
Okay.
That's why they're just kind of saying, instead of saying Shriner, Klimes, Mueller, every time they just say the Shriner et al., meaning, and all the other
Okay.
people that were associated, just so you know
Okay.
what that means too.
So it's a
Thought
kind
that
of
might be confusing.
a teacher, could be,
Yeah, yeah,
but with people.
including everybody.
Good.
Yeah, that's a lot of people. For
Thank you
sure.
so much. So that was everything for
You bet.
today. Thank you so much. I know that I'm
Thank
having a lot
you.
of mistakes at reading.
No, that's great. Really, it's just those little things that, and those again are such big words. Whoa. Yeah. Whew.
It, yes, and
That was great though.
we are learning also together, and we are
Yeah.
giving an
Yeah.
idea. And also, when we are having those classes, not only I am learning, but you also are learning, and that is something that is really good, because even if you
Yes.
are a
It's good.
teacher, you are gonna learn something new every day.
It's so true, isn't it? So true. No matter what you do. So true. Sure nice to meet you.
Nice to meet you, Angela. Thank you
Hope
so
you
much. I really enjoyed that time. I really appreciate your time, and I hope to see you soon.
Sounds great. Have a great week.
Okay, have a great week. Thank you
Buena
so much.
semana.
Thank you so
Sounds
much. And
sounds
remember
great.
that you are not helping just me, you are helping hundred of people who is going to the foundation, try to learn and try to
That's,
see a different, try to look for a different way or a different point of view of the society. And thank you so much.
that's great. That's great. Good luck, everyone.
Okay,
Take
thank
care.
you. Bye, people. Thank